All right, welcome back to another episode, our last of the session here of the Association Spotlight Series, the Legislative Short. We're just wrapping up the session here that ended this past Saturday at midnight, Mark. Crazy session in terms of up-tempo. A lot happened. Kind of recap it a little bit here today for everyone and just kind of running through some legislation that affects our association and members. And yeah, thanks for joining us again.
Well, glad to be back, and we're taking a breath here a little bit after the session's over, and there's a lot of behavioral health related legislation that we got to work on and talk about during the session.
Yeah, a lot to go through. So we're just going to run through it a little bit here and kind of break it down as simply as we can and just run through it, see what's going on. I guess first we have Senate Bill 679. Focusing on forensic group homes. I know it's been a hot topic. So just a little bit on that, Mark.
Yeah, so just a little background. So someone who is a forensic patient is someone that has been deemed incompetent to stand trial for some sort of criminal activity because of mental illness. Mm-hmm. And so a lot of the times these individuals are placed in a state psychiatric hospital, and they spend a lot of time there. So after a period of time for which they would have spent had they been convicted of a criminal act, then sometimes those folks are stepped down to forensic group homes. Mm-hmm. And so sometimes it's a little bit of a misnomer that they're stepped down to the community, and you and I talked about this yesterday, because they have eyes on supervision 24/7. So
Yep.
If they're out of eyesight of a staff member for more than 15 minutes, then that's not allowed by law. But there's been a need to construct new forensic facilities, and some of those were placed in areas that we might determine to be residential areas.
Sure.
And so it made the news, especially the one in the Huntington area, and so the Department of Health and Resources, Bureau for Behavioral Health, sort of backed up on that particular facility, and they've made other changes to the home that they're building there. But the legislature passed a law that says that a forensic group home cannot be placed within 1 mile of a residential area, a public or private licensed daycare center, public or private K-12 school, learning pod, or micro school. And so that's if new ones are constructed. Now the state may grant a variance for existing group homes. And many of our members that operate these particular group homes have not had any incidents for which the public would be at risk or at jeopardy.
Sure.
They're highly regulated, and there's a lot of supervision that takes place there. So that's one that passed Senate Bill 679.
Correct. Yeah.
Passed
So
this session.
secure facilities, and I know that's everyone's main concern. So it sounds like they got the wheels in motion for that.
Right.
Okay. Good deal there. Senate Bill 647.
So Senate Bill 647 relates to individuals that have been accused of abuse and neglect through the Child Protective Service system. Mm-hmm. So they get into the Child Protective Service is required to maintain a record of all of those allegations. So the problem is that now in our industry, we go back and we check those databases of abuse and neglect for potentially hiring employees.
Okay.
And sometimes people's names will pop up in there, and maybe this was an allegation that took place 10 or 20 or more years ago. Mm-hmm. And then they're unable to be hired. And there's no variance process for that. And there's no really recourse in the law for someone to go and say, I want my name out of that system.
Right.
Maybe there was and there's not usually a court case. It's just a civil action by Child Protective Services. And maybe enough time has passed, maybe what they were going through a divorce, or they were in the throes of addiction. Mm-hmm. Maybe even they lost their children, and now their children are back with them, and they are back in society just like you and I, and they're trying to work, and they're unable to get get a job. And so what this does is it allows for a process that certain folks can get their names expunged from that database.
Okay.
And not have to worry about this coming back up and preventing them from getting a job 10 or 20 years from now.
Gotcha. Understood. Yeah. Makes sense. Next up, we have the Senate Bill 617 rate study.
Yeah, this is one I think is really important to us and things we've talked about for a while.
Mm-hmm.
Is that our members employ folks that take care of people with intellectual and developmental disabilities, and we think that we have a workforce crisis, and we need to pay more money so that we can support those staff that we have, and we can retain them, and we can recruit new folks that want to come and work with individuals with intellectual disabilities. And what this bill does is it provides a study. So the legislature will study the current rates, and they'll actually look at it geographically. As we know, we're a really border-heavy state,
Yep.
especially in the Eastern Panhandle and some other places that folks can go across the border and make more money. And so this study asks them to look at that.
Sure.
And then there's a few other pieces in there. There's a newly hired and created mental health ombudsman.
Okay.
And this was actually created out of the closure of a long-standing mental health court case called Hartley. And so the Hartley order replaced what was an existing called court monitor with a mental health ombudsman. But the mental health ombudsman was not codified in law.
Okay.
And so that's what this does. It gives direction and assignment for what the mental health ombudsman should do. And lastly, there's a reporting piece. So we've had a lot of news stories lately where the Office of Health Facility Licensure and Certification have reported critical incidents to the legislature,
Mm-hmm.
and this just codifies that will take place on a regular basis. So at least annually, they'll report that to the legislature, and the legislature can take a look at that.
Okay. Yeah.
Yep.
That's a good explanation. Next up, after that, we have Senate Bill 239, the homelessness study.
Right. So if you've been in Charleston or Parkersburg or Huntington, especially where we're at here on Capitol Street, sometimes we have a high homeless population.
Sure.
And so the legislature wants to know why.
Mm-hmm.
Where do they come from? How can we solve this problem? So this bill instructs the Bureau for Behavioral Health to conduct a homelessness study, and they want to know how many by region. They want to know, let's see. They want to know what counties they're from, where they go to,
Mm-hmm.
and where they return to, and what reasons that make them homeless.
Sure.
And so that is for the Bureau for Behavioral Health to conduct.
Yeah, really just exploring the root causes of the issues with
Right.
homelessness. Makes sense.
Yeah, because we've talked about, do we see an explosion in homelessness due to drug treatment facilities or sober living homes expelling people to the community? So while they're coming to get treatment, and then they discharge them and they end up living on the street. So that's what they want to know. Is that happening? So we're looking forward to the results of that.
Sure. Hope to have some good answers from that. Senate Bill 208 here. We're training officers in the autism spectrum.
Yeah, there's been some cases that made the news, especially here in Charleston recently, where law enforcement engaged with someone that had particularly autism,
Mm-hmm.
and the law enforcement officer didn't know that was the case, and so they end up treating that individual like they didn't, and so the situation escalated beyond what
Right.
it maybe should have if they had known what condition this person had. And so what this bill does is it just requires that every 3 years that law enforcement officers will have a training on people with related dementias, major neurocognitive disorders, which we might consider autism as on a simpler term.
Sure. No, that's great. Yeah, that's much needed as well.
Right.
Yep.
I think that's a good thing.
For sure. Then next up we have House Bill 3306, ODCP.
Yeah, so the Office of Drug Control Policy is relatively new in the grand scheme of things in
Yeah.
West Virginia. We've had, I think, 3 or 4 directors of that office. maybe since the Tomlin administration. And the Justice Administration certainly continued that. And so what this does is it elevates that out from underneath DHHR to report to the governor. So it will be housed sort of still in the office of the Bureau for Behavioral Health, but they'll have a direct line of communication with the governor's office.
Okay.
And that's what that bill does.
Makes sense. Sure. Yep. Last up here, we have House Bill 337, kind of pertaining to the 250 bed limit per county substance abuse treatment centers.
Right. This was a big issue that we dealt with, early on in the session, is that some particular areas of West Virginia have probably more per capita substance abuse treatment facilities than their area might need. And so then some of those cities, that's contributing to their homelessness issue. And there's no certificate of need for these facilities. So there's a lot of them that have been created across the state. And we kind of believe that we probably as a state have enough treatment beds right now. But that doesn't mean that there aren't people that see opportunities in particular areas. And what this bill does is it caps the number that a particular county can have at 250 beds.
Okay.
And so we have one county, Wood County, that has about 286 beds. And I think the next closest might be Cabell County, which has somewhere around 180 beds. And so this just says that a county can't have more than 250.
Okay.
And that's what that one does.
Oh. Well, great. Yeah, that's a really thorough run through, Mark. Appreciate it. And I know our viewers and listeners will as well. It was a busy session and a lot to go through, and we'll keep track of how these develop and how they're implemented in the state.
Yeah, and now we'll take a little bit of a breath, but we're going to start getting to work on the 2024 legislative session.
I was going to say, what's up next for us here?
Yeah, we've committed to look at a lot of these issues in the off season, convene a multitude of stakeholders, and try to come back to the legislature in 2024 with consensus legislation to help with the IDD issues, with substance abuse issues. We've got some mental hygiene work that we want to do in the off season, so we've got enough that's going to keep us busy.
A full plate
until January of 24. So
absolutely. Well, I appreciate it, and thank you all so much as well for following along with this legislative session. It's been good, and Mark, thanks for running through and helping us out here and walking us through it. So it's been great.
All right. Until next time.
I know. Thanks, and appreciate everyone. If you could follow and like us on social media as well as podcast form of this video, wherever you get your podcasts, we're available. So be sure to like, subscribe, follow, and we appreciate it. So thank you guys.